Hello, my name is Adair Mosley, Chief Innovation Officer at Pillsbury United Communities. Pillsbury is a human-serving organization. We emerged out of the settlement house movement, and today we are a network of 5 neighborhood centers and 8 social enterprises. Over the next few moments, I'm going to share with you how Pillsbury is unleashing the power of human-centered design to be able to spark innovation within our organization and change the way we do our work. This conversation is about relevancy, sustainability, and creating equitable solutions for the social complex problems that our communities face. So typically, as a sector, how do we solve for those problems? Well, they show up in the form of programs and services. We have siloed approaches, but we know what works. We know that integrated strategies that work with whole families, whole communities, and the whole individuals is what creates equitable solutions. So the human-centered design process is being used by our for-profit companies. They're using it every day to be more competitive and take big risk in the pursuit of innovative solutions. So why, as a sector, are we not taking those same risks? Why are we not using the same tools and resources available to the for-profit companies to be able to drive innovation within our organizations? I'm going to share with you one example of how we're doing that. But first, I have to provide some context. The photo here represents the reality in North Minneapolis. This is where many people are accessing their foods. It's one of 30 convenience stores in North. We have a population in North Minneapolis of 67,000 people. 65% of those folks are receiving some sort of public benefit. 30,000 are on Medicaid, medical assistance. The obesity rate in North Minneapolis is 30%. The life expectancy is 8 years less than other parts of the city. You can literally travel within a few miles of North. And those that live in those other parts, life expectancy is much different. Now, this certainly is driven by other social determinants of health, both behavioral and environmental, but nonetheless, it is a public health crisis too serious to ignore. So, knowing that and using the human-centered design process, we were charged with answering a question for the state's health department. And that big question had really nothing to do with what you see as the social context of here. That question was around, how do we solve for the underutilization of the WIC program? And the first thing, as part of the human-centered design, is empathy. Empathy is how you get close to the issue. It's about proximity. To be able to fully understand what's happening, you have to be close to it. And so as we went out and we engaged those WIC users, our first big insight was that it's the Women, Infant, and Children's program. So households that are headed by fathers didn't even know they were eligible. But we immersed ourselves in their day-to-day experience. Now envision with me. You're a single parent. You're having to get on 2 buses to get to the WIC office. With your kids in tow, you get your voucher. And once you get that voucher, you then have to go to the grocery store on another bus. And once you get inside of the grocery store, you have a point of sale experience that's extremely frustrating because you can't identify the WIC products, because that WIC voucher says you need to get this right amount of ounces and you need to get this exact product. And so you'll get to the front of that register with all the incorrect things and you'll have to start over. Or you can't check your other groceries out with the WIC groceries. We learned all of this through immersing ourselves through customer journey with the end user. We understood what they valued. The second step in that is you take all of that rich information that you learn during the empathy session, and then you bring it in to define, what does this mean? And you start to unpack and synthesize that information. And this is about us asking, are we asking the right question? Are we solving for the right problem? And you get that as you start to synthesize all of that rich data. And we did that. And in this section, you start to develop a how might we solve statement. How might we solve for all of the experiences that our end users shared with us during the empathy stage? You bring that into the ideation phase. And ideation is your yes and moment. Here is where you collectively are building off of each other's ideas. I'm sure all of you experience day to day someone bringing you an idea and us telling them, no, we can't do that because of funding or whatever the resources or whatever those constraints are. But you don't do that here. You allow those ideas to flourish. And you want as many creative and innovative solutions to the problem that you're trying to solve for. And we did. And the big idea that emerged for us was a mobile WIC grocery store. And so you take that into the prototype stage. And prototype is low resolution, low cost for high impact. You're not trying to get it right the first time. You're not trying to expend a lot of time and financial resources to be able to get that prototype right. You want your end user to be able to manipulate. What does that feel like? What would it look like if it was in the real world? And we began to do that with our mobile WIC grocery store. We began to line up chairs. We began to put up fake shelving so that people could come through and tell us what was the experience like. And you take that prototype and you move it into the test phase. And this is about you getting your physical manifestation out into the real world. This is an opportunity for you to be able to build empathy again. Did we hear you right? Are we solving for the right problem? Are we making your life easier? And so we brought that mobile WIC grocery store, the prototype of it out to our community. And we tested it with those fathers who didn't even know that they were eligible for the program. And we tested it with other community members, and we had our breakthrough. We essentially solved for the challenges that we heard early on in the empathy stage. This mobile WIC grocery store would pull up in front of your home. It would have the nutritionist on board so they could check the health of the child. It would have all of the WIC products so you could easily find them, and reducing that barrier that you had at the grocery store. And so all of those problems were essentially solved for. But we hit a roadblock. The state's health department told us no, we couldn't do it because they disallowed mobile vending in the 90s because of milk fraud. Yeah, milk fraud. And so we were presented with two options. One, we could go back to the very traditional way of how we do things, a program or a service. We could have offered a class that taught parents how to use their WIC voucher. Or we could lift up the core principles of the human-centered design process that says you don't stop, you actually go back. You go back through the cycles and you keep doing it until you get your breakthrough and you solve for the problems and the challenges. And we went back. We went back and we did more iterations of it. And this time when we went back, we actually start to ask ourselves a different question. Is there something larger that we can solve for in our community? And that question started to address the chronic disease that our community faces. High diabetes, high cardiovascular disease. It started to solve for the lack of access to healthy foods. And that breakthrough, ladies and gentlemen, we kept doing that until we got to a full-service grocery store. And today, we are building a grocery store in North Minneapolis, and embedded in it is solving for the challenges around the WIC program. It unites grocery, wellness, and community in one space. We say within our organization, we're building our 6th community center. We see grocery stores as anchor institutions in community. And so that grocery store, 20,000 square feet, set to open in 2017, will solve for WIC. We can put our products in one place. We can create a seamless point of sale experience. But also, it has a clinic. And we've leveraged cross-sector partnerships to be able to bring that clinic inside that has community health workers and consultations inside of it. And then also the space to be able to build community. So, if you use the design thinking process, this human-centered approach will allow you to get through a breakthrough inside of your organizations. This is about creating equitable solutions and giving people what they need and not what we think they need. This is about engaging those who have been disenfranchised and marginalized by systems. This is about unleashing creativity and power within a community and getting them to think differently about their lives. This is about making people's lives easier. You got this. Thank you.